Now, in the third and the final section of our topic, Chagas disease, we will discuss some treatment options for the acute and chronic Chagas disease and how we approach to the patient with Chagas disease and what are some preventive measures that can prevent the Chagas disease. So acute Chagas disease is treated by the drug known as nifurtimox. The nifurtimox is markedly reduce the duration of symptoms and parasitemia. So duration of symptoms in the acute phase is reduced by the nifurtimox, and it also decreases the parasitemia or the spread of the parasites. Decrease the mortality rate. The death rate is also decreased by nifurtimox. Only 70% of acute infections are cured. Nifurtimox, the dosage of nifurtimox is according to the weight, and it's different for the adults and the children. Usually the children needs more dosage because their weight is less. So daily dosage for adult is 8 to 10 milligram per kilogram for adults. 12.5 to 15 milligram per kilogram for adolescents, and then 15 to 20 milligram per kilogram for children 1 to 10 years of age. So according to weight, the dosage is increasing from adult, adolescent, and children because the weight is different. Given orally in 4 divided doses each day. So each day it's given in 4 divided doses. So it's we can say it's 4 times a day, or QID, 4 times a day. Continued for 90 to 120 days. It's a long time, but that's the time when we have up to about 8 weeks. There is a time when there is patent parasitemia occurring, and after that we have indeterminate phase. So to reduce the illness in that phase or reduce the symptoms in that phase, we need to have the treatment, and that is for 90 to 120 days. The adverse effects of nifurtimox, we have common adverse effects. Anorexia, it causes loss of appetite, nausea, vomiting, weight loss because of anorexia, nausea, vomiting. All these can lead to weight loss. Then abdominal pain is present. That is also one factor that can cause anorexia or loss of appetite. So all these are common adverse effects of nifurtimox. Then neurologic reactions, we have restlessness, disorientation is present, insomnia, twitching, paresthesia, and polyneuritis. So these are neurologic reactions or adverse effect to the nifurtimox. Seizures can also occur. The other medicine that can be used is benzimidazole. Cure rate of more than 90% among congenitally infected infants. We know that mothers can spread the infection to the infants or newborns, so it is very, very effective in congenitally infected infants, benzimidazole. Recommended oral dosage is 5 milligram per kilogram per day for 60 days for adults. 5 to 10 milligram per kilogram for 60 days for children. 2 or 3 divided doses is given. Adverse effects of benzonidazole, we have rash, peripheral neuropathy, rare instances of granulocytopenia. So these are the adverse effects of benzonidazole. Now the treatment of chronic Chagas disease, no approved treatment. Trials being carried out on azoles and antifungal. Other treatment options, we have a pacemaker in ominous arrhythmias. Pacemakers, when the arrhythmias are really bad, you can see the patches, lead, incision for patches and leads, and this is the incision used for the generator. Implantable cardioverter defibrillators can also be used. Cardiac transplantation for end-stage chagastic cardiomyopathy. If the end-stage cardiomyopathy, the heart transplantation can be used. Approach to the patient, how we should approach to the patient depending on some negative and positive results. If the serologic testing of at-risk pregnant women, if it's negative, we don't need any further study. If it's positive of the pregnant women, if it's positive, we should do parasitologic studies of newborn, serologic testing of all the children of infected women, and refer to appropriate specialists for long-term management. So if the tests are positive on pregnant women, we should follow up the newborn babies and the children and refer them to the specialist. If the studies of the newborn are positive, then we treat them with the benzonidazole, and we know it's very, very effective, more than 90% cure rate with benzonidazole. And if it's negative, if the results are negative, we should go the testing after 7 to 10 months. If it's positive after 7 to 10 months, again we go for benzonidazole. If it's negative, then we should not do any further studies. And again, if it's negative in children, we should not do any further studies. To summarize it, serological testing of pregnant women, if it's negative, no further study. If it's positive, we should follow up. We do the testing on the newborn baby. If it's positive, we start with the benzonidazole. If it's negative, we should do the follow-up testing in 7 to 10 months. If it's positive, we go for benzonidazole. If it's negative, no further studies. So the point where we have negative result, no further studies are required. Prevention, how we can prevent just by spraying of insecticides. We should spray the insecticides. Improvement in housing. So spraying of insecticides, improvement in housing, education of at-risk person who are in the epidemic areas, in the areas where the infection is more common. We should educate the person how we can prevent the illness. Serologic screening of blood donors. Blood transfusion can cause the infection, so blood screening should be done for the patients who are donors. Tourists avoid sleeping in dilapidated houses. Mosquito net and insect repellent should be used. That concludes our topic of Chagas disease. Thank you for watching sqadia.com.